joined on the phone by Jake Tapper, author of anchor of the lead on CNN, and author of The Outpost: An Untold Story of American Valor. Jake, Happy New Year to you.
Happy New Year to you guys.
You know, Larry and I, we are shrewd observers of what's going on in the world of politics, and we've picked up on a trend. And I guess you actually don't have to be very sharp to pick up on this trend. Every Democrat is going to be talking about income inequality. And it seemed that was the theme the other day when Bill de Blasio was sworn in as the new mayor of New York. Here's a little sample of what he was talking about.
Those earning between $500,000 and $1 million a year, for instance, would see their taxes increase by an average of $973 a year. That's less than $3 a day, about the cost of a small soy latte at your local Starbucks.
So here's de Blasio talking about it. Bill Clinton was talking about it. On Capitol Hill, they're talking about, all the Democrats are. Is this? Do they think this is the message that will override all of the problems that have occurred with Obamacare?
Well, I think there are a couple different things going on here that are converging. One is, de Blasio and his unrepentantly progressive vision for New York City, and his very liberal views, and obviously he was elected with more than 70% of the vote. Then also, in addition to that, there is a desire by President Obama and Democrats to have a winning issue for 2014, and income inequality, in their view, is the way to do that. And they'll be pressing on issues like the minimum wage, raising the federal minimum wage, and there'll be an effort in the states to get state minimum wage items on ballots, hoping to drive up Democratic turnout.
Jake Tapper, the other big issue here starting the new year, of course, is the Affordable Care Act, and you saw a big PR push there on New Year's Day talking about how pre-existing conditions is no longer an issue for millions of Americans, and they were very excited, the White House was, about the approximately 1 million people who signed up for Obamacare in the month of December. I wonder, though, there seems to be a redefining of success here, or even redefining of what signing up means. Have we gotten a firm answer from the White House yet? Have you heard it at all about whether these numbers they're giving us are actually people who have completed a purchase transaction for insurance, or are they just people who on the website said, yeah, this is what I want to do?
That's a great question. And the White House says that they do not know who has actually paid the premiums, because that is between the individuals and the insurance companies. But as you rightly point out, one can think that they have signed up for insurance, and one can therefore be part of the 2 million people who the Obama administration says have signed up. But if you didn't actually sign up, or if you haven't paid the premium, that doesn't mean anything. And I don't know if any of you guys, either of you, have ever gone without health insurance, but there was a period in my life when I didn't have health insurance. And if you don't have health insurance, you don't have health insurance. Nobody's going to say, well, except as an excuse, well, I thought I signed up, or
right.
I thought I sent the check in. You either did or you didn't. You're either insured or you're not. So that's.
And there are people who may not know that until they need care, and then they find out, oh, wait, I'm not covered.
Right, and the White House has said that people should call the insurance company and make sure, but I don't know how many of the 2 million who have signed up on the website have done that. There's also, I think, 3 or 4 million who have signed up for the Medicaid expansion. The real question, though, you're right in terms of the numbers. The numbers keep changing in terms of how we're defining success. We're supposed to have 7 million, I think, signed up by the spring in order for this to be on track, according to the Congressional Budget Office. Well, one of the real issues is who is signing up. Because if you have 2 million people signing up and they are all the sickest and the oldest and the most vulnerable, and you don't have what are called the invincibles, the young, healthy people who didn't have insurance but are now required to have insurance because of the individual mandate, well, that's a problem, because what you need is a mix so that the young people, the healthy people, can be paying for supplementing those who are sick and couldn't afford insurance before the Affordable Care Act passed. So that ratio is one we need to know, and we do not know now.
I was watching your Twitter feed yesterday, as I always do. I find you to be, one of the more entertaining folks out there on Twitter. And you were having a lot of fun yesterday with what was going on in Colorado. Quite a scene there in colorful Colorado.
Well, it's just I was I can't imagine. I'm 44. You guys are I think, around my age or a little older, maybe. And the idea of marijuana being legal in a state, even if it's not legal federally, is just not to. It blows my mind. I'm dating myself with an expression like that. But so I was just trying to come up with movie lines and silliness having to do with legal marijuana. This isn't medicinal marijuana being passed, by the way. This is recreational use. Yeah, I don't know that I've ever had a tweet retweeted as much as the one I did when I said the new state motto was, "Have you ever looked at your hand? I mean, really looked at your hand."
Well, but in the meantime, Jake, is this a trend?
Yeah,
I mean, we
gonna...
just had a conversation, and it's on the slate in Annapolis. Maryland could be next. Are you ready, Jake Tapper?
I'm ready because I'm old and it doesn't matter for me. But I mean, I do think that first of all, yes, I do think it's a trend, and I do think within a generation, marijuana will be legal in most states and unenforced by the federal government if the federal statutes are still there.
Is that a good thing, though, in your mind, Jake?
I don't know. I mean, I hear arguments on both sides on this. I mean, it is difficult to argue that marijuana is more damaging than either nicotine, cigarettes, or alcohol. I mean, it is difficult to make that argument. Alcohol is much more destructive in a whole host of ways, especially in terms of physical addiction, although there is psychological addiction when it comes to marijuana. By the same token, I don't know that society necessarily benefits from introducing more ways for people to self-medicate. I don't know that that's necessarily a good thing. So I'm really ambivalent, and I hear both arguments on this. David Frum was tweeting about this yesterday about how this is only going to hurt people who are the most vulnerable and the most exposed and vulnerable to these kinds of opportunities to get high. And there have been all sorts of reports about the increased drug problem in Colorado, and I can't imagine that's going to improve with this new supply of legal stuff.
All right, Jay. Well, listen, if Frum's against it, you've sold me. I'm all for it. Thanks, Jake Tapper. Always good to have you. Of course, the host and lead of, the anchor of The Lead. Why are we tripping over that
I don't know
today?
why. We've only done it 100 times.
You know why? It's because it's a new year.
Yeah.
Thanks, Jake. 4 p.m. weekdays on CNN.
Happy New Year.